We appreciate you all being here. My name is Lisa Sturdivant. I'm Vice President for Research at the National Housing Conference. For those of you who are not familiar with NHC, we're a national organization that provides resources and research around affordable housing issues at the federal, state, and local level. We make use of opportunities like webinars to connect with housing professionals and with others working on the ground to expand access to affordable housing. And we are happy that you have joined us for this webinar, which I anticipate will be very informative. I'd like to thank the National Association of Realtors for sponsoring this webinar, as well as 4 upcoming webinars that we'll be having later this year. Future webinars will cover other topics related to housing and community development, and we hope that you will look out for announcements for those events. So to get us started, we have 3 great panelists on this webinar. I'm going to introduce our 3 panelists and then turn it over to each of them one at a time and go through their presentations, and then we will have time for questions at the end. As the title suggests, this webinar is really focused around the housing needs, both the current and future housing needs of an older adult population, and we have 3 experts with us to provide their insights. Our first speaker is Jennifer Malinsky. She is a senior research associate at the Joint Center for Housing Studies of Harvard University and lecturer at the Graduate School of Design. At the Joint Center, she works on housing policy and planning issues, including homeownership, housing for older adults, and land use regulation. She is co-editor of a recent book, Homeownership Built to Last, Balancing Access, Affordability, and Risk After the Housing Crisis. And she is project manager for the Joint Center's report on Housing America's Older Adults, Meeting the Needs of an Aging Population. So we welcome Dr. Malinsky to the webinar. Our second speaker is Rodney Harrell. Rodney is Director of Livable Communities for AARP's Public Policy Institute. Dr. Harrell's research on housing preferences, neighborhood choice, and community livability are all integral to the Livability Index project that will measure the livability of every community in the U.S. Dr. Harrell is also a speaker, researcher, and blogger on livable communities issues and leads AARP's social media efforts and serves as AARP's housing expert. So we welcome Dr. Harrell to our webinar. Finally, we will have Janet Viveros. Janet is a senior research associate at the National Housing Conference. Her research interests center on the connection between affordable housing and education, health, and economic self-sufficiency outcomes. Ms. Viveros has co-authored several of NHC's annual reports, including Housing Landscape and Paycheck to Paycheck, that document affordable housing needs. She has also examined promising models for housing older adults and disaster mitigation strategies for affordable housing. So we welcome Ms. Viveros to the webinar as well. Before we get started, just a few final introductory notes. Our most frequently asked question, is this being recorded? And the answer is yes. An archived copy of this webinar will be made available. We will send a link out to everyone who registered once the recording is online, and we try to do this within 48 hours of the webinar. Second, please note that all of the participant lines are muted in order to ensure a clear sound quality for everyone. However, we'll be taking questions at the end of the 3 presentations. If you have a question at any time during the webinar, please submit it through the question box, which you'll see on your GoToWebinar control panel. Finally, to address the issue of technical difficulties, we hope the webinar runs smoothly for everyone, but we know this doesn't always happen. So if you run into any technical difficulties during the webinar, please use the help menu at the top of the GoToWebinar control panel to locate technical support. If that doesn't work, please visit the GoToWebinar support website, support.citrixonline.com. You can also make a note to us in the questions box if there's something about the audio or something about the slides that we might be able to fix on our end. So with that, I am going to turn the presentation over to Jennifer, and she will take us through some of the research that the Joint Center for Housing Studies has been doing around housing and older adults and really set the stage for the rest of the conversation. Jennifer, the floor is yours.
Thank you, Lisa, and thank you to the National Housing Conference for the invitation to be part of this webinar, and to the National Association of Realtors for their sponsorship. In September of last year, the Joint Center for Housing Studies released a report that you just mentioned, Housing Older Adults Meeting the Needs of an Aging Population. It was prepared with support from the AARP Foundation and motivated by the tremendous demographic shift that the country is undergoing with the aging of the baby boomers. The report takes as a given that housing is a platform for good quality of life, for financial security, physical safety, and engagement in the community. So while housing is important for quality of life is true for all ages, there are some particular ways that it is a linchpin for older adults, security, safety, health, and engagement. So first, the cost of housing is tied to financial security in retirement and the ability to pay for other necessities like food. Older adults who are not in housing they can afford cut back on other necessities like food, health care, long-term care, transportation, and even saving for retirement, setting up problems down the road. Given that disabilities rise with age, the physical structure of housing is tied to physical safety and the ability to remain independent is also important. And finally, the location of housing matters. Older adults who are in homes that are not well served by good pedestrian infrastructure or transportation services may find it difficult to remain engaged in their communities and may face isolation in their homes. And I just said finally, but really finally, older adults who need some form of care in their home may face the risk of premature moves to nursing homes if housing and care cannot be coordinated. So those connections between housing and health care are also really important.
Hey, Jennifer, this is Lisa Sturtevant from the National Housing Conference. I so hate to interrupt. We're getting some indications that we're having a little bit of trouble hearing you.
Yes.
And I wondered if you could, if you were willing to go ahead and use the dial-in number
Sure.
instead. I know we talked about that. I apologize for having to stop you.
Sure.
And at the same time, I also wanted to mention that it looks like you have your last slide up, and that's what we see. So I just wanted to make sure that we were seeing what you wanted us to see.
Right. Okay. Hold on. Let me dial in.
Okay.
Okay.
Thanks very much. Thanks, everyone on the line for your patience. Rodney, with your indulgence, I wonder if we might encourage you to go first, or we could wait just a few minutes until Jennifer dials in.
Sure.
Okay, let me pass this over to you, and I will allow you to take over for a few minutes. Thanks very much.
Okay, sure. So, hi everyone. I am going to talk a little bit about the livability index that was mentioned in the introduction. Now, I'm very excited to talk about it today. Normally, I have to spend a lot of time doing the type of things that Jennifer is going to share, which is talking a lot about the needs of older adults and how meeting those needs is important. But what I get to spend time today talking about is how we are developing this livability index that we're launching and how it can really help to move those housing efforts. So here's me and the team that's put together this index project from AARP's Public Policy Institute. We're very proud of this work, and it's a great team. And it helps to get us through the AARP principles. And you'll see here our livable communities definition that includes housing that's affordable and appropriate. And the idea here being that housing should meet all people's needs regardless of age, income, or physical ability, and that it's connected to things like transportation, community features and services, civic, economic, and social life. All of these things being connected at once is one of the keys there, and one of the key things we're trying to get across. So our principles themselves are things like creating communities that have all of these things connected, improving health, and maintaining personal security and safety, engaging residents in the process, and the like. And these principles guide all of the policies that AARP supports through all our advocacy and other work. On the housing side specifically, we have principles around improving home design, promoting affordable housing options, strengthening federal programs, promoting financial security, and supporting residents in all types of households. So, and also looking at home and community service-based delivery as a way to meet people's needs where they are. We want to help people stay in their homes and provide all the things they need to do that. So you'll see there's a wide range of things that we're looking at doing. And why is that? Well, Jennifer's going to get into a lot of this when she speaks, but quickly, in 2010, older adults were 13% of the population, and by 2030, that's 20% and over doubling in number. So in less than 2 decades, we'll have 72 million people that are 65 plus. And so these issues that impact a certain number of communities now impact every community within a few years. And we need to start planning now to make sure that we have all the housing options that people need and community options that allow people to stay there. Because of these preference issues, which are that we consistently find that people want to age in their homes and communities. Over 7 in 10 people 50 plus, and over about 9 in 10 when you get to the time folks are 65 plus. People want to stay in their homes and communities for lots of reasons. Their church might be there, their favorite place to hang out, their family or relatives or friends may be there. So there's lots of reasons that people want to stay in their communities, but we know that they do. And so the goal should be to make communities work for people. Now in the short term, by providing the kinds of things that help make up for the fact that a community or home might not meet your needs, or later by actually having communities and homes built differently so that they support people of all ages and incomes and abilities. So for these and many other reasons, we decided to build this livability index. And the idea is to create a web-based tool that takes into account older adults and captures the livability of every community, every block group, every neighborhood, every zip code, every county, every city across the country to understand how livable that place is. And again, back to that livability definition from earlier, it's how well these communities meet the needs of people regardless of their age, income, or ability. And so the first time we're doing that, and we are going to, because we're ARP, we're going to make sure to include the needs of older adults in that. So the framework that we use to put this together includes taking individual preferences that people said. We did a huge survey about 1.5 years ago, and we looked at all the things that people said they wanted in communities, but we looked particularly at people at different need levels, because one of the things we learned was that people do not necessarily do a great job of predicting their needs into the future. So we took all those preferences of people at different points in life, factored those in. Then we took objective measures. We looked at all the data that we could get at a nationwide level down to the block group level and said, from all of this, what can we make sense out of in terms of understanding communities? And we looked at policy interventions to understand whether or not there were steps being made to improve communities in the long run. And we put all that together, and when you put all that together, you get a score for your neighborhood or community. So these are the 7 categories we've got in the index. You starting from kind of smallest to largest, housing being that core, but then things in your neighborhood. These are measured, and I'll go into housing in detail, but in our neighborhood domain, there are things like whether or not you're close to healthy food sources, or how safe your neighborhood is, etc. In the transportation area, we're going to look at things like your proximity to transit and how often transit runs in your neighborhood. What are the total transportation costs? And since most people drive, we'll also look at road safety issues, how expensive transportation is, and also those safety issues like traffic deaths and the like. In the environment, we're focused on air and water quality and things that create issues there. In our health domain, we look at a broad range of things, from hospital quality to a range of factors that really look at the community health issues. And then in social engagement, we're looking at things like voting rates and how well or how often people in the communities interact with each other, how many volunteers opportunities there are, those kind of things. And in our opportunity issue area, we're looking at things that create opportunity for all people again. So there we're looking at things like income inequality or the education, the graduation rate, so let's look at education levels, or how much low-income people are making in terms of wages, and what the minimum wage policy is in that area, for example. So we'll see there's a range of things we're looking at across all of these areas, and there are connections between all of them. The general connection is that that location matters, right? And so that location where your home is more than just, is it close to work, or is it the style of house that may appeal to me? It's figuring out the connections between location and that social engagement. Are you in a place with neighbors that meet your needs, or that a place that's safe, or a place where people communicate and have volunteer opportunities and the like, or in a place where there's housing options that are affordable in case you lose your job, or in case your income changes or a spouse passes, or what have you. Environmental factors, like those factors of air quality and water quality can be issues, and all of those things really impact your health and connections to transportation as well. But since we're all folks that are really interested in housing, I'm going to go into a little bit more detail on what we have in this index that's going to be on housing. So these are the four main attributes of housing that we cover: accessibility, affordability, the range of options, and where that housing is located. And if you clicked on housing in the index, you'd see these things. So under accessibility, we're looking at a definition of housing accessibility that includes many universal design features. Those of you that are experts in the area might notice that we don't have anything about the entry in a home. And the reason why we come up with this particular definition is because the Census Bureau, when they track it, they keep track of ramps. And the idea being that we don't want to necessarily promote ramps as the solution. It's really creating housing stock for everyone that meets their needs, and not modifying with ramps just for people that have a particular physical disability. So we've created this specific definition of a few features that meet accessibility needs. We're also looking at multifamily housing in terms of options that may meet your needs. Like I said, if your spouse passes, or if you lose income, you might need a housing option, or perhaps if you don't get around as well as you used to. So you want to have options other than the standard single-family home, because otherwise you may be forced out of your neighborhood, which happens to many people who can no longer get around their home very well. They have to make a choice to either stay in a home that doesn't work for them and make do, or just not have something that they can afford. And so having an option might allow people to stay in their neighborhoods. So that's important. And we have 3 measures of housing affordability here, because it's very important. So a straight measure of housing costs. We're also looking at housing cost burden, which allows us to compare housing costs to incomes in the region. So if you're in a high income region, you might be okay with a little bit of higher housing costs. Well, that first measure would really look at perhaps if you're looking at homes across the nation, or if you were retired, or what have you. So we want to have both of those measures. And finally, we're looking at subsidized housing, which I'm very excited that we're able to get the subsidized housing units per capita. And we're going to make the strong argument that it's important for every community to have affordable housing, because if, again, that safety net issue, that not everyone is prepared to lose their income, or to lose their job, or to have some issue befall them. But it's nice to have that as a backup plan, just in case. And I mentioned that we're looking at policies to see if places are improving themselves over the long run. So we've just looked at things that are looking at your community today and where it sits, but these 3 things, 3 issue areas, look at improving things over time. So inclusive design laws, whether they're for universal design or visitability or any other name, will help create more housing with a wide range of features over time. So that's important. And also provides a great range of options. And then on the affordability side, we're looking at places that have foreclosure prevention and protections, and that will help us to look at places that will prevent neighbors from being impacted by mass foreclosures, which has happened in a lot of communities across the country, and housing trust funds, which will help preserve affordability in the future. So if those trust funds are in place, you can sleep a little easier knowing that you may have more affordable housing in your community in the future as well. So again, you'll see that we have things measuring where things are now and into the future. And so the index will be used by hopefully a wide range of people to look at their communities and make their decisions about what their communities need, whether it's public officials, community stakeholders, even our ARP state offices and community affiliates, folks in the research community, and even the general public, people that are thinking about moving, or people that are just want to check out their own neighborhood. We think they'll find it interesting. Now here's the unfortunate part. The index is not available yet, so I can't really show you how it works. We're going to release it April 20th to the world at large. It'll be a main feature of an entire day we have dedicated to the issue at the American Planning Association conference, and you'll see a lot more to come about it. But here's what our front page looks like, so there's a little tease for you. And you can get this and more information, and you'll see in the little left-hand side on our new web page, which I encourage you all to visit immediately. You'll be able to click on the Livability Index and get some detailed information on what's happening and what's going on. So please do check that out. And here is, again, what we're going to be launching, and we'll have some publications out that day so that you can understand it. And again, here's all the contact information for me and for my team. So I'll leave that up for a second in case any of you want to scribble that down. But please do, and please get in touch with us if you have any questions or suggestions or recommendations.
Great. This is Lisa Sturtevant, NHC again. Thank you very much, Rodney. I think it's exciting that you all are getting a first look at the Livability Index, which will be a great resource for you who are working on housing at the local level. Rodney alluded to some of the data around the older adult population and how it's growing, and so I'm going to now switch over to Jennifer, who we have back, and she'll take us through some of what we know about the growing older adult population and their housing needs. So Jennifer, I'll turn it back over to you. Thanks.
Thank you again. I hope this is better. Sorry about that, the technological glitches there. So when I left off, I was saying that the key question for us in our report was how do we, as a nation, comfortably, safely, affordably house this growing population of older adults, many of whom, as Rodney just shared with you, want to remain in their homes, but the homes that are largely inaccessible, in communities that are largely car dependent, and within a healthcare system that largely doesn't support the funding of long-term care in the home. So in my few minutes, I'm going to take you quickly through some demographic changes, and I'll discuss the 4 challenges that we identify in our report: financial security and affordability, physical accessibility, connectivity within the community, and health connections within and with housing. So nationally, the population over 50 is growing dramatically, and you can see that the first wave of the baby boomers turning 50 in the 1990s was real spark to this, the green far left bars. Now with the leading edge of the boomers crossing the 65-year-old threshold, that 65 to 70-year-old age group is nearly doubling by 2030 to just about 40 million people. After that, the population 75 and above will grow so that that group will reach over 30 million by 2040. So right now, 1 in 7 people in the U.S. is 65 or older, but by 2030, that will be 1 in 5. And right now, 1 in 16 is 75 or over, but by 2040, that will be 1 in 8. So the population is growing, and they're also growing as a share of the overall population. The population is also going to be increasingly racially and ethnically diverse, reflecting changes occurring throughout the population, and this has possible implications for multi-generational living arrangements because Hispanic and Asian families are more likely to live in multi-generational households. With age comes some risks that affect housing needs. If I could advance my slide here. Lisa, are you able to advance my slides? I'm suddenly lost that power.
I will take over, and I will do so.
Okay, thank you.
Yep.
Perfect. Okay, so the next slide, number 3.
Okay.
Okay, perfect. Thank you so much. So this shows that the population, when you reach a certain age, certain risks come into play. So risks of disability certainly rise with age. You can see the risks of cognitive self-care, independent living, and mobility disabilities rising with age. Also, chronic conditions also rise. We are managing diseases better than in the past, but the incidence of people living with long-term conditions has risen. And then finally, the chance of living alone increases. About a quarter of households in their 50s consist of a single person, but fully 3/5 of households aged 80 and over are single, the majority of which are women. So the next slide, please. Now, turning to the first challenge we face in housing the country's older adults, housing affordability and its relation to financial security. As people enter retirement, incomes fall, and that's what you see on this slide. People start off with a range of incomes in their 50s that vary by race, by tenure, but these differences largely disappear with age and converge at a median of about $25,000 once you hit your 80s. As a result, many households, renters but also owners, face housing cost burdens. And the next slide will show how this falls out. Currently, 20 million older adults, or a third of those 50 and over, face housing cost burdens. When people are housing cost burdens, they spend less than other people with similar incomes who are affordably housed on food, healthcare, transportation, and for those in their 50s to 60s, they spend less on retirement, which kind of sets up problems down the road too. Housing cost burdens are concentrated among those with lower incomes, but increasingly we find them creeping up the income scale, and we find that they also are affecting owners who are still paying off mortgages. And you can see in that middle set of bars that owners who are still paying off mortgages in their 80s are very likely to be housing cost burden, even more so than renters. There's also a particular concern that we've seen in our research for the 50 to 64-year-old cohort. This group has lower home ownership rates. They faced a dip of about 5 percentage points in home ownership during the recession that they're not likely to make up before retirement. They've also had some wealth losses from the recession. That particular group is now at its lowest level of net wealth in 2 decades. And as you can see in the next slide, there's more likely to be carrying mortgage debt into retirement. And you can see that this shows the 65-year-olds who are also carrying mortgage debt into retirement. You can see that not only the percentage of people with debt has gone up, but also the average value of that debt. So just to wrap up, that 50 to 64-year-old group is in a worse position than their predecessors. So they're a particular concern, but we see this carrying of more mortgage debt into retirement across the board. We also see more non-mortgage debt as well. On the next slide, you can see that the concern that we have about low-income renters. As the population grows, just if you kept the same percentage of the same income distribution the same and projected out with the increased numbers of the population, we expect many more low-income older adults who would be eligible for federal rental assistance. Even now, though, only a third of those adults who are eligible receive it, and the demand is rising. You can see on the far right, 2030, we're looking at over 6 million people eligible. And turning now to the second challenge of accessibility, with the rise in age-related disabilities, the need for accessible housing expands. 90% of those 50 and over who have disabilities live in private homes. So this is really an issue for addressing in private homes. Yet, if we look at the 5 common measures of universal design, we find that only 1% of the housing stock has all of these features, and 43% has one or none. So this slide shows how many have these specific features, and the next slide, slide number 9, will show the very small percentage of housing in the country that has all of those features. By age 80, your chance of having a disability is greater than your chance of living in accessible housing. And just as one example, about over 10 million households 50 and over report having someone at home with serious difficulty walking or climbing stairs. Yet less than half of these homes have no step entry. So 5.5 million report that they need to climb stairs or enter or exit their house, and yet these homes have someone who has very serious difficulty doing that. Assisted housing stock is a little bit better than market rate housing. Just over a third of assisted stock has 3 or more urban universal design features. But this is still not enough, particularly given that lower income older adults who receive housing subsidies are much more likely to be disabled. Okay, moving on to the next slide. Some of the ways that communities around the country are addressing the accessibility issue in housing is through visitability ordinances, which are incentives or mandates for accessibility in new housing. So requiring that new housing includes things like a no-step entry, navigable halls and doors, a bathroom on the first floor. The state of Vermont has a visitability ordinance that applies to the whole state. Other options include tax credits to builders or homeowners for installation of accessibility features, loans and grants, the use of Medicaid home and community-based waivers for modifying homes is possible in some states depending on their program. And then there's volunteer assistance such as through Rebuilding Together that mobilizes volunteers to help older adults modify their homes. A third concern is, on our next slide, connectivity. As Rodney says, location matters. Almost 75% of our older adults are aging in suburbs, exurbs, and rural areas that are car dependent. Yet many don't drive or limit driving, as you can see on the graph on the right. Even in cities, though, many cannot get around easily because transit may not be convenient, safe, accessible, or affordable. So given that many express a desire to age in their current community, how to help people avoid isolation in their home? And this is where the livability initiative that Rodney talked about comes in, walking, increasing pedestrian safety with great resting spots, easy safe crossings, safe sidewalks. If you could show the next slide. Pedestrians aged 65 and older accounted for 20% of all pedestrian deaths in the United States in 2012. So it's really important to improve the environment outside the home. And the good news is that this works for all ages. Transit, again, is another need, but as I said, must be accessible, affordable, go where older adults want to go. And then the housing options in areas that are well connected are also important. So building closer to downtown, closer to transit. Finally, the last challenge area that we examined was housing and healthcare. We're concerned about how people who need long-term care can obtain it in the home or community in order to avoid a premature move to a nursing home, which is less desirable from a quality of life perspective and much more expensive. We know that 70% of those reaching age 65 will need long-term care at some point, and that care is expensive, as you can see on this slide of median monthly costs. On the next slide, we can see that nationally, the median renter could not afford 2 months of in-home care based on their net wealth. They can afford less than 1 month in a nursing home. That's partly why people rely on family for their care, but future generations will have fewer caregivers to rely upon. That 50 to 64 cohort has fewer children than its predecessors. So this slide, I think, gives you a sense of both some of the benefits of home ownership. Homeowners have 44 times the wealth of the typical renter, but also the extensive costs for anyone, whether homeowner or renter, for nursing care and some of these other care options. Given that there's a desire to age in place, trends away from nursing care, we're looking more at expanding affordable housing that has long-term supportive services. There's a variety of models for doing this, and I think Janet will touch on these as well. Expanding HUD programs to provide housing with supportive services, nonprofit models that do this, Medicaid support for aging in place, again, the use of home and community-based care waivers for providing long-term care in the home rather than Medicaid's traditional just paying for care in a nursing home, which for a low-income person can lead to a premature move there. So while we have some good pilots and models, more options are needed, and that definitely involves better coordination among housing and health programs at the local, state, and federal levels. So just a closing thought, these are issues that affect all of us all across the country, and you can see in this map in 1990, the red sprinkled counties throughout the country are counties where 40% or more of the population was age 50 or over. So you can see some in Florida, some in the Midwest. If you fast forward in the next slide to 2010, based on census data, you can see how many more counties have a greater older population. due both to aging in place, to younger people leaving, but both of these factors. But how this is really a nationwide issue that communities across the country have to come to terms with how to age their older populations safely, affordably, and in ways that keep people connected to their communities and not isolated in their homes. So thank you, and I'll turn this back to Lisa.
Great. Thanks so much, Jennifer. I think that's such a great background on the growth of this population, as well as a lot of the issues that communities around the country are facing. We've gotten, excuse me, we've gotten a number of good questions submitted, and if you do have questions for any of our panelists, I do encourage you to submit them in the questions box. We're going to hear from Janet, who's going to talk a little bit more in depth about one of the points that that Jennifer ended on related to housing and services for the adult population, older adult population. So with that, I will turn you over to Janet.
Thank you, Lisa. Today I'm going to talk very briefly about a report that NHC released last spring called Aging in Every Place, Supportive Service Programs for High and Low Density Communities. And our report profiles several different programs and models for offering supportive services in the homes and communities of low-income older adults in different kinds of settings, ranging from dense urban communities, medium-density suburban settings, and dispersed rural communities. We looked at some common elements that made these programs successful, as well as some of the differences in the structure and offerings of these programs tailored to the needs of the older adults they serve. So, as Jennifer explained previously, the needs of many older adults change as they get older. They're at much greater risk of developing chronic conditions as well as impairments that make it challenging for them to live independently and safely. In addition to making sure a home is accessible, it's also important to consider what kinds of supportive services are necessary to help older adults who may need assistance in their home and community, to provide them the opportunity to remain in their homes longer and prevent potential moves to assisted living facilities or nursing homes in order to receive care. As Rodney mentioned earlier, most adults prefer to age in their homes and their communities. In 2010, an AARP survey found that 90% of the people they questioned over the age of 45 wanted to live in their homes as long as possible. So it's important that we consider the desires of most people to age in their home. And as Jennifer pointed out already, long-term care is extremely expensive, particularly when people receive it in nursing homes and assisted living facilities. In 2012, the average annual cost of a semi-private room in a nursing home was over $81,000, and a private room in an assisted living facility was over $42,000 on average. Also, it's important to consider supportive strategies in home and community settings as an important way to help older adults age in place, because some studies have found that they can actually achieve better health outcomes than assisted living facilities and nursing homes in some cases. And it's also an important strategy to consider because states are increasingly looking at ways they can offer long-term care in home and community settings for more older adults in order to reduce the spending on long-term care that we were able to see in some of Jennifer's slides, as well as to comply with the Olmstead Supreme Court decision, which requires that states deliver long-term care in the most integrated settings appropriate. However, there are many barriers to aging in place. Jennifer took us through some of the accessibility challenges, but there are other issues that arise when older adults develop chronic conditions or complex health needs. Difficulty completing activities of daily living, such as getting in and out of bed and bathing, along with instrumental activities of daily living, including preparing food, can really inhibit the ability of an individual to age in their home safely. As we heard from Rodney and Jennifer, lack of access to transportation is a huge problem for older adults and can prevent them from accessing doctors and health care, running errands, going to the grocery store. It can also be particularly challenging for households to manage chores and finances if older adults are physically or cognitively impaired. And there's also a particular issue of social isolation. Almost 45% of older adults live alone. And coupled with the lack of access to transportation, this can inhibit their ability to leave their home and interact with others, which can have negative impacts on their mental health. Supportive services refers to a wide range of services that can help address some of these barriers. They can include personal care and home chore assistance, medication and case management, basic health monitoring, as well as social activities and wellness education. So in our report, we examined many different supportive service programs that were offered to older adults in their homes and communities. And these programs typically offered many of the same kinds of services that I just mentioned, but there were also some differences in their structure and some of their service offerings because the needs of older adults also vary by the kind of community they live in. For example, at the programs we looked at in urban communities with lots of large multi-family buildings, we are more likely to find large concentrations of older adults in a particular building or a complex. We found that programs typically were partnerships between the housing provider, either the condo association or the property manager, as well as local health or social service organizations. In these cases, the property manager typically provided space and some funding so that the health or social workers could host office hours for residents in the building. In these programs, oftentimes resident service coordinators worked collaboratively with the on-site healthcare provider by sharing information with residents about wellness, education, as well as sharing information with the health providers with permission of residents about the status of individuals. What the programs often found is that the building staff could use their existing relationship with tenants to not only encourage participation in these programs, but to also encourage residents to seek out services if their health changed. They also, with permission of the residents, could let the health workers know if there had been a change in the well-being of a particular resident, so they could reach out to them. They also were able, in some cases, to collaborate to resolve housing issues that are common amongst older renters, in some cases like hoarding or late rent payments, so they could avoid evictions and other negative outcomes. In terms of suburban communities that we looked at, citing services on site is more challenging because older adults are more likely to live in single-family homes and smaller multifamily buildings. So we found that many of the programs would create a base in either a central multifamily building in the neighborhood they were serving or in a local community center that was easily accessible, as well as augment their services with home visits as necessary to address the needs of clients who couldn't travel to their offices. There was also a greater focus on social activities and transportation to events and cultural excursions to combat social isolation, of particular challenge in the case of older adults who live alone in single-family homes, as well as an acknowledgement of the needs of homeowners in particular by offering services such as modest home repairs and organizing volunteers to shovel snow. And then finally, looking at rural communities where older adults typically live in single-family homes dispersed across a wide geography. Accessing health care and services is particularly challenging given the lack of public transportation and the distances between where people live and where services are available. So much like the suburban programs, rural programs would find a central location in the region that was known to older adults, such as senior centers, and also focus heavily on offering transportation services to help older adults reach their doctors and different healthcare providers, as well as helping them with minor home repairs and delivered meals, and in one case, utilizing NRV to bring multidisciplinary health teams to the homes of clients and to senior centers across the region to complete monthly health assessments and offer basic health services. Now, despite the differences in the details of all these programs, we found that there were some common themes that made them very successful. The first was that these programs were guided by the preferences of older adults. In fact, many programs were created as a direct result of older adults expressing a need for more support in order to remain in their homes. The programs found that older adults were best able to determine what kinds of services they actually wanted and needed, and this contributed to developing trust between the program administrators and the residents they wanted to serve. Programs also found that they needed to be flexible and evolve to serve a wide range of needs that change over time. Programs that were flexible in their service offerings and in regular discussion with participants about their needs found that what their clients wanted changed over time, and they needed to add services or create new partnerships in order to meet those needs. And finally, the programs built upon partnerships with local either health providers or social service agencies, as well as community stakeholders to offer their programs. By working with community stakeholders, they were able to build trust with the community they wanted to serve, as well as learn about the needs of the older adults in their community. And by collaborating with other service providers, they were able to holistically approach the needs of older adults in the community. Typically, older adults have a great variety of needs and wants that no one service provider can meet particularly well. So through collaboration with housing, health, and social service providers, programs were able to offer rich services and conduct effective outreach. If you'd like to read more about the individual programs we profiled, you can take a look at the actual report, and I've provided a link here. And now I'll hand it back over to Lisa.
Great. Thank you very much. So we got to hear a little bit about some specific ways in which the needs of older adults are being met. And I see we have a number of questions that have come in. So I appreciate everybody bringing in their questions. I'll start with a question first for Rodney. Rodney, you had talked about the livability index, and I have a question here about whether the transportation component of the livability index includes transportation options such as demand response transportation options or paratransit options, service that may be more likely to be available in rural areas than urban areas. Could you talk a little bit about the types of transportation options that are included in the livability index?
Sure, and that's a great question. Now, the issue that affects us here and affects us throughout the index was we had to keep track of things that we could get nationwide. And so, we're tracking whether or not there are state or regional human transportation services coordination councils, whether or not they're volunteer driver programs, ADA accessible stations and vehicles. But in terms of kind of the demand responding, nothing more specific than that, because we couldn't get that data nationwide. We've also got a lot more general things that aren't focused on working with people with disabilities or older adults, but we were limited by the data that's available. And by the way, we are absolutely open to hearing about more data that we could include into the future if we do have a national data source for some of these things.
Great, that's very helpful. We have another question sort of related to the availability of local data. And Jennifer, I'm wondering if you might be able to weigh in on a question someone asked specifically about how much housing is needed for the 55-plus population in Boston, but I'll spread that a little bit wider. If people are interested in finding out about housing needs for the older adult population in their community, is there a good place to go to find that kind of housing needs information for the older adult population at the local level?
Sure. We have some data on our website. If you go to www.jchs.harvard.edu, you can find the whole report, but we also have some state and metro data just that's only on the web, and it includes things like housing cost burdens and some other information. So hopefully that could be of help. The map is also there in a more interactive form.
And it's Rodney, I'll jump in quickly again, that Boston was one of the places we looked at a few years ago. We did a study called Preserving Affordability and Access in Livable Communities. It's also on our website on the arp.org/livable policy. And Boston was one of those cities that we looked at, especially in the areas near transit, that there are needs for older adults, and preserving some of that housing that's there and that's affordable, and making sure housing is needed, or make sure we meet housing needs, excuse me.
And one of the other things I would suggest, Boston has just begun this, so I'm not sure what data is available, but the communities that are linked with the World Health Organization's community, age-friendly communities like New York have a wealth of information about their older populations, as well as plans, proposals, and ways of addressing various issues.
Great, that's great. I think there's a lot of interest in finding out about local needs, and so I have another question here about where we might go to find information on states or communities that have developed good programs for older adults, similar to some of the social service programs that Janet mentioned. Janet, I'll turn it over to you first. Are there places that people can go to find information about successful local programs that serve older adults?
Thanks, Lisa. Yeah, I think a great place to start is actually a website that we put together with the support of AARP called housingpolicy.org. We have a whole toolkit devoted to the housing issues of older adults that profile a lot of great and innovative approaches to meeting the needs, particularly the housing needs of older adults. Another great source to look at for local information is your local area agency for aging, or your AAA, which is another great spot if you're looking for something specific in a region for a particular person. That can be a great resource as well to find out what's available in your area.
And I'll toss out another AARP resource that might be helpful in this way. And it's a sister site to the one I've been mentioning. It's aarp.org/livable. And this site has a lot of AARP's information. AARP is the national affiliate in the U.S. for the Age-Friendly Communities program that we mentioned earlier. So we've got a lot of resources for those communities, as well as all of the work that AARP and partners have done across the country. So you can get to that through the website I mentioned earlier, or directly through aarp.org/livable. Great.
So I have another question here. Jennifer, I might ask if you might take this question first, but there's a question about the idea of making homes accessible for older adults, where there's this big need in the short and mid-range. But then we can think about this population cycling out of their housing, perhaps moving on to different housing or just aging. And then the question of what will happen to this excess housing. Is there going to be excess housing currently occupied perhaps by the baby boomers when you have a smaller generation behind? Do you have any thoughts on what that means for some local communities, or what that might mean nationwide in terms of housing supply?
Sure. I mean, I think one quick answer is that the advocates of universal design would argue that housing that is built to be accessible through universal design will not be specific to a certain age, but to all ages and all abilities. So in that regard, should be perfectly usable for years to come, in fact, more usable than the current stock. But yes, in terms of what happens when baby boomers start to sell off their homes, we have a great blog on that on our website, coincidentally, this week. So I urge you to check it out. But talking about how the current stock may not be what the millennials and people coming behind are looking for in housing in terms of where it's located in the type of housing. But I think that makes some of these options about making our communities more livable, more diverse in terms of our housing stock, infilling with things like accessory units and downtown apartments that are accessible but also located near transit. I think it makes that all the more important. So I urge you to check out that blog. And the issues are there, although not imminent, but certainly something that we're keeping our eye on.
Rodney or Janet, do you have anything you want to add on that topic?
Well, I'll just add that double the point that making these accessibility changes in the way that we design housing is really the key. And it's really, from our vantage point, it's a philosophy change in the way that we build all housing. The goal is to really make every housing unit have a wide enough doorway that people can get through, or walkways and bathrooms and kitchens that are accessible that people can get to. Not just for the people that live in that home, but for all people who may visit that home, both now and into the future. So the argument that I make is even the counter argument that it makes sense to do housing this way, especially when we're talking about housing built with public money, but even private money as well, that we want to make the housing usable to that widest range of people and still have it be attractive and pretty and everything else that housing is.
Great. I have a few questions here about the issue of co-housing. And so, Rodney, since I have you on the line, I may start with you.
Sure.
So there's kinds of communities and that we're talking about today, and co-housing wasn't mentioned particularly. And so the question is, what your thoughts might be on the viability of co-housing or multi-generational models. And then I'll add a follow-up question is, what needs to be done at the local level to make these kinds of housing be allowable under local zoning ordinances, for example? Do you have some thoughts on the co-housing notion?
Absolutely. And so housingpolicy.org and the ARP.org/livable will both have some work on co-housing that's worth checking out. So co-housing for me falls under this housing options question, right? That we want to make sure that we have options that meet everyone's need. And co-housing, for those that don't know, are purposefully built housing units that allow people to have common spaces that they share and the like. And its cousin, shared housing, again, is something else that we're seeing people share housing perhaps in growing numbers in years to come. But we expect there to be a more interest, but we don't necessarily expect these to be mainstream options for everyone. So what I would, and what ARP would like to see is that that we don't have restrictions in place that limit housing, and sometimes we have these zoning regulations from years ago that were designed to prevent nuisances in neighborhoods of various kinds. So we want to see those kind of barriers removed, but we acknowledge the fact that these are the housing option that works for certain people and won't work for others, but we need that wide range of options to meet everyone's need.
Yeah, no, that's a great thought, this idea of having housing options. There's another question about NORCs, naturally occurring retirement communities, and neighborhood naturally occurring retirement communities. And so, Janet, I'm wondering if you could answer this question about whether NORCs can serve as service options for older adults, and what kinds of communities are these kinds of NORCs evolving?
Sure. NORCs, as Lisa mentioned, are naturally occurring retirement communities. So these are often buildings, complexes, neighborhoods that are not age-restricted in any way, but over time become communities that develop a high concentration of older adults, that either because older residents have stayed and aged in place, or it's attracting older residents. And so you start to develop kind of a critical mass in the community that you can reach out to and create programs around. So NORCs and neighborhood NORCs can really serve as a platform and a foundation for putting together supportive service programs, either on site, as I described, in urban communities, or in central locations in suburban communities, to acknowledge that you have a large older adult population that you could and should be serving. And we actually profile both an urban NORC and a suburban NORC in our report, so you can learn a little bit more about them there.
Great, thanks. So, thinking about solutions, I have a question here about the federal Section 202 housing program, which is really no longer funded, no longer a source for senior housing. And so the question is, does this responsibility for providing housing for an older adult population, particularly low-income older adult population, does this really fall to the states and localities? Jennifer, I don't know if you had thoughts on that, about how responses to these housing needs will fall to maybe localities, given the reduced amount of federal funding, and what that might mean for innovation at the local level.
Yeah, I think given that the low-income housing tax credit is still there, obviously, but is only able to marginally fill the need that we're experiencing and that growing need. And I failed to mention before, not only is the need growing, but we're losing units as they expire. So it's sort of a double need. And with the limitations of Section 202 not being no longer providing capital grants to develop new housing, we're really falling back on vouchers and public housing and rental assistance that is already very limited. So yes, I think it does put pressure down onto the state and local level, and hopefully one of the things I think is interesting is what we've been talking about with the supportive housing is that there are cost savings that could be gained through keeping people, the cost savings really accrue to Medicaid by keeping people in housing, and if you can keep people in housing with some supportive services and delay that, there is a cost savings. And wouldn't it be great if we could use some of that cost savings to do some innovative things on the housing side? So that's a difficult thing, obviously, but some area where there may be, we may be able to have some innovation.
Great. Rodney or Janet, I don't know, did you have anything you wanted to add to that question about sort of the local response?
Well, I think there's some states and localities that are doing some innovative things already, and so those kinds of programs and initiatives should be lifted up and duplicated where we can. The goal should be to try to create, again, even at the affordable level, that range of options, that there's some benefit to creating housing that where older adults are so that we can concentrate services and that kind of thing. But there's also some benefit to some of the other solutions that may have more dispersed housing as well. But again, we know that there's a huge affordable housing shortage, that affordability issues are impacting people of all ages, including older adults, and we just need to come together in every way possible to try to meet those needs.
Great, thanks. I know we're at 3 o'clock, but there's a few more questions. I'm going to ask 2 more questions, and then we'll wrap up. I've had a couple of questions come in about the reverse mortgage program. And I wondered, Jennifer, I'll start with you. Do you have any information you could provide about the potential benefits or maybe the potential pitfalls to older adult homeowners of using reverse mortgage products? Is there anything that your center has done research-wise on that mortgage product?
We haven't. We looked at it a bit in the report. Certainly, it is a small percentage of of what's happening out there. It's an option for being able to stay in your home. There are lots of pitfalls, including people taking them on at the earliest possible age and really converting their equity in their home to taking their equity out of their home and then not having enough to cover expenses like property tax and such things down the road. So there's a sense of not using it as a long-term way to pay for your housing, but to sort of take out that money up front. There have been other concerns that I believe have been addressed, such as when a person is, when the mortgagee passes away and the spouse was younger, they're not listed as a mortgagee, so there are lots of issues like that. But certainly it's one of many options that people have for paying for long-term expenses, housing expenses and long-term care expenses, but so too are conventional loans and home equity loans.
Great, thanks, Jeff. Okay, for our last question, I'll ask each of the panelists if they want to weigh in or add anything else, but there's a good question about, and I'll start with Janet here, if there are ways that we can bring down the cost of housing older adults. I think the cost is one of the key components when you're trying to bring housing and health services together. And what do we know from the research on what opportunities there are for cost savings when you combine housing and health services?
Thanks, Lisa. I think Jennifer talked a lot about the cost of long-term care spending, which is something that most older adults are going to need. And there is research that points that this can be far more cost-effective when you deliver it to older adults in their homes, in their communities where they want to be living anyways. And to think about how you can use the cost savings on the health side to really focus more on the housing costs for older adults. So it's far more affordable in this big picture to think about helping older adults to stay in the home where they already are versus thinking about how to pay for them to live in an assisted living facility or a nursing home for a long period of time. So I think there needs to be a continued focus on how to make housing affordable to older adults. either thinking about making sure there's enough affordable options that are accessible in a community, thinking about ways to help older adults afford property taxes on a home they may have owned for some time through property tax exemptions and credits and things like that. So I think it's also a matter of being creative and helping older adults to continue to afford the home they live in or a home that's appropriate for them in their community.
And if I could just add to what Janet was just saying, the Affordable Care Act itself cites a figure that it can cost for the amount of paying for one person in a nursing home, Medicaid could pay for 3 in the community with long-term supportive services.
That's pretty striking. Rodney, did you have anything to add on the cost effectiveness or anything we know about that from the research?
Well, sure, and I think I'll loop back to something we talked about earlier, asked about earlier, which was examples at the state and local level. And I think there are some of those innovative practices, and one of those being the Vermont SASH program, Services and Supports at Home, SASH. So folks can look at that. And our friends at Leading Age are actually doing some great research on looking at the impacts. But in short, what they did there was they actually created this integrated long-term care service provision with their housing, and looks like they're having some great success. And so finding those successes and building on them is really the way to move forward, I think. And I think there's interest at that, even at the federal level, looking at ways to do that. I'll say that we have a large barrier in the fact that we are still siloed in our thinking that health, for example, that housing and health and human services are in completely different federal legislative committees at the congressional level, and different folks work on them, and they speak different languages. And more importantly, they have different budgets. So savings on the health side don't really help out the housing folks, and vice versa. And those are the type of things we need to really come together and fix nationally, so that we can really do the things that are best and most efficient for all of us, and recognize those cost savings.
Great. I think that's a great way to end this notion that this idea of serving this growing population really will require innovation at the federal level as well as at the local level, and really breaking down silos among the transportation, health, and housing communities as we seek to meet future needs. I want to thank all of you for your attendance and your questions. I know we didn't get to all the questions, and I apologize for that. I also want to thank you for bearing with us during our early technical difficulties. We will be sending out copies of the PowerPoint presentations and a link to the recording of the webinar within the next couple of days, so keep an eye out for that. Thank you very much to our panelists, Jennifer Malinsky, Rodney Harold, Janet Viveros. Thank you for joining us. And thanks to the National Association of Realtors for its financial support of the webinar series. As I mentioned at the beginning, with the help of NAR, NHC will be holding webinars regularly on a variety of housing policy and research topics over the coming months. More details on these webinars, including the links for registration, will be available on our website at nhc.org. I invite you to visit nhc.org as well as the Joint Center for Housing Studies website and AARP's website to access resources that they've had a chance to share with you today. And thanks again for joining us. Have a great afternoon.